Very good evening to all of you friends. Radhe Radhe. In this particular video, we are going to talk about mechanism of breathing. Mechanism of breathing. Okay, I hope it is visible to all of you. Friends, mechanism of breathing involves two steps. First of all, first step is first step is inspiration or inspiration. Second step is expiration. Inspiration and expiration. So our breathing involves these two different steps. Inspiration involves when we external air drawn in inside our thoracic or pulmonary chamber. That is inspiration. When we uptake O2, okay, and we releases CO2 out of the lungs. In inspiration we take oxygen. So when air is coming inside your body, right? So in the atmosphere and in your pulmonary chamber or pulmonary chamber, there will be a pressure gradient. Without a pressure gradient, these air present inside your lungs or present outside your lungs, it cannot be go inside or outside. Are you getting me? See, your suppose these are your lungs. Okay, these are the lungs, and this is atmosphere outside your lungs. Okay, so if in the atmosphere there is a high pressure of air pressure is high as compared to lungs. In your lungs, suppose pressure is less. So what should happen here? Pressure air should move from high pressure to low pressure, right? So if this in this case inspiration will take place. Okay, and in the case of expiration, suppose these are your lungs. My lungs shape are changing from this to this. Anyway, uh, in lungs, see, if there is high pressure and as compared to atmosphere, in atmosphere there is low pressure. So expiration, this state happens. This is happening. Your lungs pressure, the air pressure is high inside your lungs than atmosphere. That's why air moves out of the lungs. So this is the pressure gradient between atmosphere and your lungs. These things you have, these two things you have to remember. And how this pressure gradient is created. That's what we are going to study. See, your inspiration is initiated by the your muscle called diaphragm. So first step is contraction of diaphragm takes place. So your diaphragm, which is a dome-shaped muscle present under your lungs, and it is attached with the rib cage or thoracic chamber, right? So when it contracts, what happens? It increases the volume of thoracic chamber, or we can simply say increase increases the thoracic volume. Okay, increases the thoracic volume. How? In the antero-posterior axis. Antero-posterior axis. Okay, it is increasing. Muscle, your diaphragm is contracting, then your thoracic volume, and in the anterior posterior axis, it will increase. After that, what will happen? There are muscles present inside, in between your ribs called internal and external intercostal muscles, they will contract. Then second step is contraction of external intercostal muscles present between your ribs. There are some muscles present between your ribs called external and internal intercostal muscles. Second step will what will happen? Contraction of external intercostal muscle will happen, which will lift your ribs and sternum. Okay, which will lift the ribs and the sternum. This is the next step. Then what happens? Because of this, again, your thoracic volume is increase in thoracic volume. But now you have to remember thoracic volume. Now you have to remember in this is anterior-posterior axis. This is dorsoventral axis. Dorsoventral axis. These two things you have to remember, guys. See, whenever your diaphragm is contracting, thoracic volume is increasing by anterior-posterior axis. And when your ribs and when your external intercostal muscles are contracting, there is same thoracic volume is increasing, but on the dorsoventral axis. Question can uh, come over this topic. You have to carefully remember that by contraction of what the thoracic volume is increasing, which way, either it is anterior-posterior or dorsoventral. Okay. Then what happens? What happens is there will be increase in pulmonary volume, which is the volume of your lungs. And this pulmonary, because of the increase in the pulmonary volume, it will lead to decrease in intrapulmonary pressure. Pressure is decreasing. Everything is increasing, but pressure is decreasing. Why? Pressure is decreasing. Why? See, if this is a classroom, okay, so this room, if I break this wall and the next room I joins to this room, what will happen? I'm increasing the volume, so that's why the pressure, the air pressure will ultimately decrease because I have increased the volume, right? Air pressure on this wall will also decrease because I am increasing the volume. But here there is increase in the volume, that's why pressure is decreasing. So this decrease in the pressure than atmosphere. So your atmosphere pressure is constant, right? But because of the change in the intrapulmonary pressure, it is decreasing. It is atmospheric than atmospheric pressure. Air comes inside, and that is inspiration. So it leads to the inspiration. Inspiration. Okay, because of the pressure gradient. The reverse process happens to this. What happens? First, contraction. This in this case, relaxation will take place. Relaxation of diaphragm. Then decrease in the thoracic volume. Decrease in thoracic volume. But anterior posterior axis, it will lead to decrease the relaxation of external intercostal muscles, external intercostal muscles. Then it will have the ribs and sternum to their normal position. Sternum and ribs will comes to normal position. This will decrease the thoracic volume, decrease the thoracic volume by dorsoventral axis, which will decrease the pulmonary volume. Okay, which will decrease the pulmonary volume. Okay, then which increases the intrapulmonary pressure. Increase in intrapulmonary pressure than atmosphere. So now pulmonary pressure is high. So what will happen? From high to low, from lungs to atmosphere. So from lungs, air will move from lungs to atmosphere, which means will leads to expiration. Expiration. Okay, it will lead to the expiration. So these are the steps of inspiration and expiration, guys. I hope it is clear now. Uh, each and every step is clear to you. We will meet in the next video. Before that, I want to talk with you about this video. Okay, I will mention it in the next video. Till then, goodbye. If you like this video, if you found this video helpful, please share this video with your friends. Thank you so much.